Live, late breaking. Wesh 2 News Sunrise on CW18 starts now.
New research suggests that COVID-19 is hitting communities of color especially hard. Let's look at this study released last week by the CDC. African Americans make up only 12% of the U.S. population, but according to the CDC, they account for a third of people who have been hospitalized with coronavirus. Joining us now is Dr. Nolan Kline. He's the assistant professor of the Department of Anthropology at Rollins College. We appreciate your time here this morning. And Dr. Kline, can you tell us why this is so greatly impacting communities of color?
Yeah, absolutely. Thanks so much for having me. And to answer this question, the answer has to do with what we in my field call the social determinants of health, or these conditions and communities in which people are born, live, and work. And these can include things like how safe our neighborhood is, the education we receive, the jobs we might have, whether we have insurance or access to health care, even access to grocery stores. So when we look at this issue through a social determinants of health lens, we can begin to see why these populations are really affected. There are three main points that stand out to me when I look at this most recent CDC report. So first, African Americans and Hispanic or Latinx populations are more likely to be exposed to COVID-19 because of their jobs. A lot of us are working from home right now, but many of us are considered essential employees and have to continue reporting to our places of work. These kinds of jobs include being a caregiver, a cashier, a sanitation worker, a farm worker, or a public transit employee. And these jobs are often filled by African American or Hispanic and Latinx populations. So this means because of the jobs that people are engaging in, they're more likely to come into contact with someone who might have COVID-19. The second reason is that African Americans or Hispanic or Latinx populations are more likely to have or lack access to health insurance. So some people might actually avoid seeking care because of the financial consequence of seeking a doctor when they're uninsured. I should also point out that the third reason that really stands out to me here is that these are populations that are more likely to have health conditions that worsen COVID-19 and make it fatal. These conditions include asthma, obesity, and heart failure. And again, we can look at the social determinants of health to answer why those conditions exist in these populations in the first place. So, for example, African Americans have higher rates of exposure to air pollution based on where they live, and that results in some of these conditions.
And Dr. Kline, the CDC analysis that came out looked at 14 different states. Florida, though, was not one of them. When you're looking at this, are we seeing a similar trend?
You know, right now, the data don't necessarily say we're seeing the same kind of trend, but I want to remind everyone that Florida has not yet hit its peak, so we just need more data to tell us before we can make any sort of conclusions.
Absolutely. Dr. Nolan Kline, we appreciate your time here this morning trying to go more in depth on what these numbers actually mean for our state and for the nation ahead. We appreciate it.